Thank you everyone for joining our conversation on message-meg. There's a silent virus that is transmitted sexually. It's very common, but you may not know that you have it. It's human papillomavirus, and half of those infected are adolescents and young adults. Now, it can cause cancer. There is no cure. But on this episode of message-meg, we're going to tell you about a promising new scientific study from a simple food supplement that might be able to help. It's fighting both HPV and types of cancer. But first, a quick refresher of how you get HPV, what it does, and correcting the myths that are out there. We get that information from an expert. She is obstetrician gynecologist who specializes in treating cancer, Dr. Amelia Jernigan of LSU Health. And you are a wealth of information. So let's start. How do you get HPV?
Through sexual activity. It's
just intercourse?
Intercourse or any sexual activity, really. So you can get it without classic vaginal, intercourse. But that's the most common way. And it's extremely common. 80 to 90% of people have been exposed and have had it at some point in their lives.
80 to 90%. Okay. And it is any type, it's oral sex, anal sex, it can be transmitted. But we don't know. There's no signs like you hear when you're growing up, oh, you're going to get this symptom or that. You have no clue that anything's going on because you don't feel anything.
That is absolutely correct, Meg. So there's a reason that cervical cancer and other cancers associated with HPV used to be #1 killers of women and are no longer because we have great screening mechanisms, but it is relatively asymptomatic until it's quite advanced.
Okay, so a large percentage of people, it goes dormant or they clear it without ever knowing it. Is it cleared or just sleeping somewhere in their system?
So a little bit of both, but it can sleep someplace in your system. So the vast majority of people will in fact clear HPV from their system, which is great news. But for a variety of reasons, sometimes it's the type of HPV that you get because there are multiple different strains, some of which are higher risk than others, and other things like if you're immunosuppressed, like if you've had an organ transplant, or if you're on medications for inflammatory bowel disease or other autoimmune conditions, or if you have HIV, things like that. Those are all risk factors. Smoking is a risk factor. So we know that there are environmental things that put you at risk for sort of carrying that infection, but it can lie dormant in the cells of your body. That's the way the virus is built. It can actually hijack the cells in your cervix or in other parts of your body and then make more copies of itself. And by lying dormant, it can look like you cleared it, but it can reemerge years later.
So we've all heard of get your pap smear, and when you get your pap smear, they not only check the cells that they scrape off of your cervix, of your uterus, but they also are checking to see if you have HPV. Okay, so and that'll come back and say even the number, like number 16 is a dangerous one.
It often will.
But otherwise you don't know if you have it, and men can get it and get penile cancer. So how would a man know if he has it?
Yeah, so men really don't know. Penile cancer is excessively rare. It happens, we see it, but it is not anywhere near as common as some of the other cancers. So there's not a standard mechanism for screening for penile cancers. Now, it also causes anal cancer, and there are people who screen for anal cancer in higher risk populations, so that does actually exist. It's the same thing as a pap smear, just of the anus. But it's also important to make sure you're going to the dentist and getting oral exams because you're at risk for throat and oral cancers with this as well.
Baby boomers are because it takes a while for those viruses that are hidden to damage the cells of your skin or the back of your throat from oral sex. Okay, no treatment, no cure?
Well, it depends on what stage they catch it. If with advanced disease, it is often difficult to cure. With earlier stage disease, especially when we're talking about cervical, anal cancer, oral cancers, you really can treat it with surgery alone sometimes, or radiation, or sometimes it's a mix of chemoradiation, or the three things together.
But no cure for getting rid of HPV in your system.
No.
Which we're going to talk about that food supplement. Come up. I was surprised when I was doing my research, doctor, for this. I had forgotten that Farrah Fawcett was only 62 when she died of anal cancer.
Right.
And HPV is the biggest cause of these types of cancers and cancer of the cervix. A lot of women don't go have their pap smear once a year.
Yeah, and we actually know that concerningly, rates of screening are downtrending. We know there are certain pockets of the population that we're not screening as frequently as we want to. There are a lot of reasons for that. Our screening guidelines have changed quite a bit. The addition of the HPV testing to our standard pap smear, which was really looking at the cells under the microscope, has allowed us to stretch out the intervals between paps. But, I mean, as we all know, sometimes it's harder to do something once every 5 years than it is once a year. So people kind of get out of the habit. So now it's a really exceptionally high rate of being underscreened in our population.
That's scary. So you go to the OBGYN, you have your pap smear, you don't have HPV. Don't come back in a year for your pap smear, come back in 3 to 5 years. But then you have another sexual partner.
I know.
To me, that scares me that people would think, oh, I don't need to go back and have my annual pap smear. Does that concern you as a cancer physician?
Absolutely, and I think your concerns are absolutely valid. I think the take-home message I would say is that OBGYNs are very important for women's health, and so whether they're doing a pap smear or not, I think everyone should go for an annual exam because women's health is more than a pap smear. There's so much to it, and like you said, if you have a new sexual partner, we may need to talk about certain things, and it may not just be cervical cancer, but you should be seeing a GYN every year.
But what also concerns me is that you may have no sexual partners for 20 years and you get the virus, and you said you've seen marriages get in trouble over this when that virus from decades before was sleeping, woke up, and then the spouse thinks, oh, you've had another sexual partner. Explain that to us.
This is something I see very commonly, and especially when we first started incorporating the HPV testing into our screening. Because what was happening is you'd have women, no abnormal test results, no abnormal paps, and then they'd suddenly get a pap and it'd be HPV 16 positive, and they were sure their husband had just had an affair, they were filing for divorce, and you're like, oh, please don't do that. That is not what this means. This just means either you or him, which means you could have brought this in from years ago, he could have brought this in from years ago, had the HPV virus. We need to make sure that you're not harboring cancer or pre-cancer, but it does not mean that anybody is just recently cheated or anything like that. It's not the same thing as a primary like herpes outbreak or something like that, which would be more indicative that something recent had happened.
Yeah, and Farrah Fawcett died because hers, which they thought they had cleared, they said she was clear, it was gone. It metastasized to her liver, and that's what ultimately, at only 62. Okay, Gardasil. We've heard a lot about this vaccine. It's approved for, what is it, 6 years old up to 46 years old?
Yeah, and they really are targeting, they're really trying to target kids around like 9 to 12, 9 to 13.
Before they're sexually active.
Absolutely. You want to get this on early. And the nice thing about doing it at that age is it's a 2-shot series at that age. If you wait, it's a three-shot series, so it's a little bit more. But you can get it up to the age of 45. We definitely recommend up to 26, continuing to get it. I'll catch all my patients up through 45 if I can, because frankly, it's just a really great vaccine. It prevents cancer in multiple spots, and it's very low risk to get.
But it was controversial for a while because there were some people who think, well, if I give this shot to my 9-year-old, it's going to make him think, oh, I can be sexually active. But
They've looked into this.
Okay, and what do the data show?
Turns out that 9-year-olds do not take that information and run out and act promiscuous. Okay. And the reality is that's not the conversation to be having with your 9-year-old when you give them a vaccine. A lot of 9-year-olds get vaccinated against other things. Hepatitis vaccines prevent cancer as well, and you can get those through sexual intercourse. It doesn't cause promiscuity or misbehavior. It's just a vaccine to protect them in the future.
The other myth out there about Gardasil, and I heard this from healthcare professionals, from nurses, oh my goodness, if I have it, it's going to cause infertility down the line. But what did the data show on that?
Debunked. That is not the case. It will not cause infertility at all. I think you can feel very, very assured that if you get the HPV vaccine, you are no more likely to be infertile than if you did not.
I think baby boomers, they wish they would have had Gardasil. I mean, I literally have stories of friends of mine who my father saved their life by saying, go immediately now, you need a hysterectomy, because the cervical cancer had already become worse. And that makes you infertile. Of course, by the time, if you're a baby boomer now, you're past those childbearing years. But have you seen women who have HPV, it cause infertility in them?
Yes, I mean, especially in the sense that having HPV sometimes would mean that we would have to remove your reproductive organs. Just a month ago, I did something called a radical trachelectomy on a woman, a very young woman in her very early 30s, not yet married, still wants kids. And we were able to preserve her uterus, but we actually had to do this very rare and advanced procedure to remove her cervix and the tissue around her cervix and her lymph nodes, and then reattach her uterus back to the top of her vagina. So she theoretically can have a baby, but her pregnancy and getting pregnant is going to be much more complicated now.
And someone, back to Gardasil, someone older who has HPV, or anyone who has HPV, can you get the vaccine as therapeutic? Will it help it go away?
So the long answer is we don't know, but the short answer is we think so. And the reason I say this is because when they were initially studying the HPV vaccine, they brought people into a clinic, they did a pap smear, and then they either gave them the vaccine or a placebo, which means not the vaccine.
A fake one.
Exactly. And they followed them over time to see if they were going to get cervical dysplasia, which is the precursor lesion to cancer, the thing we see before cancer develops. And of course, what they saw is that the vaccine's tremendously effective, but what they saw in a subsegment of the population, and that was those that came in to get their PAP, and at that visit they were found to have dysplasia and then got the vaccine, they really cut the risk of recurrence of their dysplastic disease in half. So we think so.
Okay, and dysplasia is when the cells on the cervix, they're not cancer yet, but they're not 100% right.
They're not normal. They're heading towards cancer.
Okay. All right. So the bottom line is, you have no signs or symptoms. It's not like other sexually transmitted diseases where there's burning or there's warts or something.
Right.
There's absolutely no signs. And you said almost 90% of people are exposed, and half of those are young adults. Okay.
Yep.
Anything else you want to get across before we move on to this segment, this excellent segment about this new food supplement that they're seeing? Have you heard about what it's doing?
I've not, but this sounds very interesting. I think there's a lot of really interesting ideas out there.
Yeah. Okay. Dr. Jernigan, thank you so much for joining us.
Great.
Now, as we mentioned earlier, there are studies on a simple food supplement that may have promise in clearing your system of HPV, and it's also being studied for its effects on cancer. One of the world's top mushroom experts, yes, mushroom experts, joins us from California and is going to explain it all next. Here at message-meg, we were intrigued when a woman who had persistent HPV infection that would not clear took a certain mushroom supplement and finally, after years, got an all-clear HPV on her pap smear. So we wanted to turn to the science and found one of the top mushroom experts in the world. Mycologist Dr. Christopher Hobbs wrote Medicinal Mushrooms, The Essential Guide: Boost immunity, improve memory, fight cancer, stop infection, and expand your consciousness. And he joins us now from California. And Dr. Hobbs, it's a pleasure to talk to you.
Thanks, Meg. Wonderful to be here with you.
Okay, so first of all, one of the things that I've been learning is that some extracts from certain mushrooms boost your immunity and are even being used against cancer. Can you explain that to me?
Oh, well, yes, it's really quite amazing how popular mushrooms have become as dietary supplements, or even just adding more mushrooms to your diet, because of all the research that is emerging for the health benefits of mushrooms. And all mushrooms are really worthwhile to add more to your diet, like shiitake and lion's mane and so forth, just because of their incredible high fiber content. They have wonderful prebiotic fiber, highest of any food, really. Vitamin D, tons of trace minerals like zinc, copper, and iron. So they're a wonderful food, and high protein, many of them. So they're almost a complete food and a great slimming diet food. But also they have beta-glucans, which are cell wall components. They're big molecules that can activate our immune response in a variety of really profound ways, very deep ways that can help bolster our immune system to fight viruses, cancer cells. There's a lot of clinical trials on the extract of turkey tail, for instance, for use in cancer care programs. So it has a lot of science behind it. and of course, thousands of years of use. I mean, many cultures in the world eat mushrooms almost every day because of their health benefits and because they just feel good and they taste good.
Okay, so let's, on HPV. In one study, I read that 64% of the patients were HPV negative after 6 months, and this particular extract called AHCC supplementation. So, and it's from a certain shiitake mushroom. So what do you think about these studies? Do we need more? Are they conclusive yet? What is your opinion?
We definitely need more. From what I've seen, and I did look at the literature and I created a summary table of the studies that are available on AHCC. So AHCC is simply a fermentation process, and this is how almost all medicinal and edible mushrooms are grown today in the U.S. There's a grain, typically brown, organic brown rice or brown rice, sometimes straw or wood, but often brown rice. And then the rice or the substrate is inoculated with the particular mushroom, strain of mushroom or species of mushrooms, whether it be oyster mushrooms or turkey tail. In this case, it's actually not turkey tail, it's which many of the studies were based on for cancer care. This one is from shiitake, and so the substrate or the rice is inoculated with the oyster mushroom mycelium, which is the vegetative part of the mushroom. So it grows in and it eats up the rice, and then it produces all of these enzymes and other compounds through the fermentation process. Then they take that and they freeze dry it and grind it up to a powder, and that's basically what AHCC is. Now, there is one small clinical trial, or maybe two, for HPV benefits, and it did show positive results. However, and there also are a couple of animal studies that show similar positive results. But the studies so far are fairly small and not statistically what I would call robust. So we still need more studies for sure, but one thing I can say about AHCC, it's incredibly safe. Mushrooms are a food medicine, and there really is no downside as far as taking them.
Now, what I was reading was that this was in women, and of course there are many different types of HPV, and this was on, I believe, 16 and 18, which are more likely, it's sexually transmitted, and more likely those are the ones that cause cervical cancer and other cancers in women. So the study showed, in the small study, 3 grams a day. So if we, the average person, we go to the supplement store, we look online at Amazon or something, what are we looking for to take, and what is it going to say on the label, and how do we know we're really getting that active ingredient you spoke about?
Well, yeah, that's one issue with the dietary supplement industry in general, is that every batch should be tested. And so as long as the manufacturer is reliable, how do we know if they're reliable? There may be a number of different products out there. I recommend sticking to a product that has a track record. How do you know about that? For instance, if one company develops the actual process and product, and then other people see that other companies see, oh, it's selling well, I want to create one. So they start making their own maybe, and who knows about the quality. So that is a concern throughout the dietary supplement industry. There are a lot of good products out there, that's true, but there are also some knockoffs coming in from China or other countries which may not have the same quality. So how do you know? Just try to look online, check the reviews, as I always do, and see how many people liked it, how many people bought it. I mean, that's one of the best things you can do, is just go on Amazon or some other company and read the reviews.
And so Dr. Hobbs,
does vary.
Tell me again, the product should have lower amount of starch in it, but say again the active ingredient that you just spoke of, and would we see that on the label?
Yes, AHCC is a a modified product from the action of the mycelium on the substrate. It ferments it, and it produces this compound called AHCC, which is just a modified starch, an acetylated starch, which is shown in a couple of clinical studies and some animal studies to boost the immune response, and a couple for HPV. So that you want the active ingredient and you want the amount stated on the product, AHCC, and the amount. If it just says AHCC, how do you know how much is in there? So again, read the reviews, read the labels, use critical thinking. You mentioned the dose, 3 grams, that's about 1 teaspoon. That's probably a slightly heaping teaspoon is 3 grams. And where they got that was most of the clinical studies for cancer care and turkey tail, that's the dose they use, 3 grams twice a day, for instance, or maybe even once a day for moderate use.
So turkey tail is a different type of mushroom. What type of mushroom is that?
Turkey tail is the most widely studied of all medicinal mushrooms. And again, for cancer care, it's been studied in thousands of people. That's just a different type of mushroom. There are many species of mushrooms. There's oyster mushroom, there's shiitake mushroom, and there's turkey tail. Now, turkey tail is not an edible mushroom. It's a hard mushroom that grows on dead and decaying wood, but it has a high level of these beta-glucans, which activate all of our immune responses. And again, this is the most widely studied of all. And there are turkey tail extracts out there that you can get on the market. I know several companies that have very good products. And so I don't know if I can mention on the air.
Yes, go ahead. Now, turkey tail is the one studied with cancer, and AHCC is the one studied with HPV. But go ahead and tell us the ones that you, as a world expert, know are effective.
Well, we've got a couple of brands that I can mention right off the top. One is from Herb Farm, HERBPHARM, Herb Farm, and they have a capsule with guaranteed beta-glucans. And this is really important because you know how much you're getting of the actives. The other brand is Real Mushrooms, and they have a powder as well of just about every major species. So those are the 2 brands that I know for a fact are offering standardization, and that's important.
And Dr. Hobbs, we should always say people should check with his or her doctor before taking anything. But you say basically this is food and it's safe, and we should tell people more isn't necessarily better. Is that all correct?
Mushroom extracts and products are very, very safe. At least the edible ones that we're using, excuse me, in the clinical trials and in the studies. Those are all edible mushrooms. They're food medicine. They have really no downsides. And I've been doing this I've been teaching about mushrooms and written 3 books on it for over 35 years. So I can tell you, and I incorporate them myself in my own diet every day. Reishi, turkey tail, shiitake, and I can guarantee you that they are very, very safe. And so I don't think it's necessary to mention it to your doctor, really.
Okay.
That's my opinion.
Well, that's why we come to you. And I read this other study where TV, a certain type, plus GL, that's another type, got rid of HPV in 88%, whereas another type of mushroom, just LS, was only 5%. So there are types of mushrooms that are more effective in boosting your immune system so that it turns against HPV.
Right, and we were talking about AHCC, which is derived from oyster mushrooms, or shiitake, I guess oyster mushrooms. So when you say TV, that's Trametes versicolor. That's turkey tail. And when you say GL, that is reishi. So turkey tail and reishi are the highest mushrooms of any mushroom in these incredible beta-glucans. And so those, when people ask me, well, what are the first 2 I should start with if I want to incorporate these into my diet, into my supplement regime, it's always going to be turkey tail and reishi, because those are the very highest in these active compounds.
Well, yeah, I was going to make you say the official name, those official names for them, but it's amazing the difference when this particular study compared the 2, when women had HPV 16 and 18, 2 that are known to cause cervical cancer. those two together had 88% effectiveness, where the other one only had 5%. All right, doctor, well, you've really enlightened us. And just one quick final thing. You know those white mushrooms that you get? I know they're low in calories. I love to put them in my salad that you just get at the grocery. Do those help in any way?
Those are button mushrooms, and we might cut them up and put them on our salads, or we might cook a dish with them, a stir fry. But actually, button mushrooms, which are the world's most widely cultivated mushroom, have very low amounts of these active compounds. They're still good, they're fine to eat, but you're going to be much better off with shiitake or oyster mushrooms or lion's mane. They have a lot more medicinal and nutritional benefits.
Okay, Dr. Christopher Hobbs, and we mentioned your book. You have 3 books, so I'm sure people want to really dig down into the science. They can learn from those. Thank you so much for joining us and educating us from California today. Thank you. Coming up next week on Message Meg, there's an invisible health condition that mostly affects young and middle-aged women. It's called POTS, and after COVID, cases skyrocketed. Yet many women are still being told it's all in your head. We wanted answers to what's really happening, and the response has been overwhelming. Now we're digging even deeper. It's a conversation you won't want to miss next week on Message Meg.